Have you ever dreamed of joining us as a co-host of MedSurg Moments? If so, that dream might just be one step closer to becoming a reality.
Soon, AMSN will be initiating a nationwide search for 2 new co-hosts to join our MedSurg Moments team.
Wait, don't they need a whole bunch of podcast experience like us?
Eric, they'll need exactly as much experience as we had when we started, which was 0. So if you're listening, don't worry, no podcast experience is required. Just a passion for MedSurg nursing and an AMSN membership.
Keep a close eye on your email in early November, as AMSN will be sending out a co-host survey application to all AMSN members. Complete the application by the deadline to take the first step in the co-host selection process.
The email and survey application will also include everything you need to know about the time commitment and the volunteer term. So keep an eye on that inbox in early November, and good luck. The content within the MedSurg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
On this episode of MedSurg Moments.
So I don't know what happened after 45 minutes, or maybe it might have even been 50 minutes. But at some point, I relaxed and I remembered things going dark. And then I remember seeing a light or seeing some kind of flash above my head. And when I woke up, I felt like I had just slept all
night. This is Eric.
Maritess.
Sydney. Sam.
Neo.
And Laura. Welcome to MedSurg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud MedSurg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is complementary and integrative nursing, but as always, why don't we start with some personal updates? Laura, what's new?
Hi, Maritess. Not a whole lot's going on with me. No news is good news. Things are just trucking right along. Family's good. Work is great. Not a whole lot to report. Eric, what's up with you?
Just working on myself still. Doing physical therapy, hoping to get back to work next month. Things are working well. I had a minor setback. I've lost all the muscle in my leg, so I fatigue super easily. I'm working on keeping my mental health good because it is drawing. I remember in a previous podcast, I said I didn't want to talk about it. I didn't want to talk about it because I didn't want to turn into one of my patients where we start to define them by what their illness is. And I did not want to be known as Eric with a crushed ankle. I think I kind of shunned that a bit, but I feel like it's healthy for me to address it and stay positive because it is really hard to stay positive. I've shut a couple people out, but I've been trying to do better about that. I'm not embarrassed by struggles. I'm okay saying I need to have some me time or I need to be around people because I can feel like the darkness creeping in. So that's what I've been working on, just staying positive and looking forward and not focusing on today. Sam, what's going on with you?
Well, we have made it to my favorite time of year. The fall is my absolute favorite. I live in an area where we have all 4 seasons. And so all the leaves are changing. It's getting a little crispy in the mornings. It is just absolutely my favorite time of year. And my husband and I also really love watching football. So we watch college football all day on Saturday, NFL all day on Sunday, soup in the crock pot. It's just all about the fall vibes. But other than that, everything has been going really great, adjusting to both of us being back at work and then having little Theo at daycare and things like that. So just kind of learning a new routine, but everything has been going really well. And it's been a great couple weeks since we've all been back together. So let's kick it over to Neil. What's new with you?
First of all, I want to acknowledge Eric. I guess that's your apology for not texting me back for 2 weeks when I've been calling you and checking on you.
That was
you and my mom. It was personal.
Yeah, that was just because I didn't want to talk to you.
Okay, good deal. Because, when I was with my mom, so you guys, what you don't know is Eric and I are in a very strong bromance. since he's the other male. So I try to check in on Eric since I check on my mom, knowing that they're both going through some major surgeries. So I'll accept your public apology, Eric, and acknowledge our bromance on air.
Well, Neil, have you ever considered that the
time change bothers you?
No, if
you're slow still.
I know I am. You're right. The factor in your mother and my life is you. So I wonder if you might be the issue.
I am the common denominator, usually. Yeah, I play that role very, very well. In greatness and excellence and in being top 100. And speaking of all my accolades, actually, as I come upon the end of my 100th academic career, I was pleasantly surprised with a message on LinkedIn from one of our local colleges, High Point University. It's a small private school here that just started a nursing program. They actually had their first graduating class of 2. 2 things have happened. I've had my first interview for a clinical instructor with them for first semester students, and I've been invited to speak to their senior student class about leadership. So super anxious, super excited, super nervous. I've been lucky enough one time before this to commencement speaker at my community college that I graduated from. So there's a couple of different topics they said I got to speak upon, and I'll probably do some, almost like we talked about one of our last ones, our lessons learned for leadership in nursing. So I'm super excited about getting involved in my next academic step of professionalism. A lot of people say, you're going to jump ship already? I'm like, no. I want to stay bedside as long as possible, stay relevant, dabble in the education book, and then go full-time academic and have the students like Eric that are the difficult ones and take care of them. Maritess, what's going on in your world?
I am very excited for you, Neil, and I'm very sure that a lot of those graduates would learn a lot from you. I'm very excited for you. It's always so nice to share messages to a lot of nurses and those who are thinking of what they wanted to do in the future. Nothing new, but I'm with Sam. Fall is a nice season. I live in Florida, not really a lot, but you know how we decorate our houses with fall leaves. The kids usually do like fall festivals, and they do all these cookies for the church. They also make a lot of trinkets and then sell it to raise funds for a lot of local events. And so that's my favorite time. And I laugh a lot about that because they enjoy it. But for me, I'm like, oh, I'm teaching them entrepreneurship, teaching them those soft skills. So our topic today is complementary and integrative nursing. And since it's my topic, I'll share a little background as to why I chose it. Personally, when I heard that we wanted to have some clinical, non-clinical topics, I've always wanted to talk about this. Being an immigrant coming to the United States, I am a huge proponent of using alternative medicine. I remember one time I was having some serious pain, and instead of taking Tylenol, because if I take Tylenol, give you a trivia, if I take Tylenol, I'm dead for 12 hours. This is like the regular Tylenol. Perhaps my perception, my mindset is telling me that this is what's going to happen to you. I always believe the mind is so powerful. And so when I was in pain, they were telling me, take Tylenol, take this and that. But what I did was I went to the acupuncturist. And so I did acupuncture. And so my question all the time is, when we are at the bedside, not a lot of the physicians, not a lot of nurses are embracing the practice. I'm not saying to embrace my practice, but study says if we combine alternative complementary medicine with Western medicine, which now it becomes integrative health or integrative nursing, that provides more relief to pain management is one. Another would be doing the rehabilitative medicine. So I really wanted to ask your perspective regarding this topic and what do you think? And if you have stories to share regarding patients who are practicing or coworkers or colleagues who are practicing.
I think there's some stigma associated with this approach, at least what I've seen. I know at my hospital, they do acupuncture, they do alternative treatments like that. But I think when you hear a lot of nurses speaking about it, or not even just nurses, just people in general, I think there's a lot of stigma attached to it, depending on where you're from, how you were raised. And I had a back injury and I did acupuncture and I stopped doing it only because I didn't want to. You know what I mean? It's not anything good or bad. I remember I went there the first time and he poked me for like 30 minutes. He goes, see, don't you feel better? I'm like, no, I don't. So I felt like it went both ways. When I told people that, they're like, oh, why'd you go to acupuncture? Oh, you went, you know, you hear things like snake oil, voodoo, witchcraft. I think a lot of the issues we have, especially as a nurse, is if I'm listening to the family and they're like, I want to try this kind of treatment, then it's up to me to convince the doctor to agree with it. It's like many hurdles. More education is needed on everyone's part and understanding.
A big part that we don't realize is some of our cultural stuff is legitimate. I know when I was in school, we did an alternative medicine class. Eric, you had mentioned acupuncture. What's going to a chiropractor without going to a masseuse? Because you could crack those bones into place, but guess what? Muscle has memory. It's going to pull it right back. So unless you're doing some stretching, some yoga, some massage therapy, that back's going to just go right back out of alignment. I'm an old school 80s, 90s wrestling fan. And there was a little while I was trying to lose some weight after I had done too many night shifts for a while. And I hooked up and started watching that DDP yoga. This isn't a promotion for anything. It's kind of yoga and Pilates in once. There's some dynamic movement to it. And you get a different stretch and burn. My posture was a lot better. Just you feel so much better overall. I've never met a nurse not with a bad back of some sort. It's just how bad is the back. And I never felt any pain at that time when I was practicing some good yoga.
And an ankle. I had a patient who told me that the only way she can get rid of her nausea was through acupuncture. She had severe nausea and no one would listen to her. And I remember speaking to a doctor and said, look, can we just try it? And he did. It took many attempts, but he actually listened to her. They called the acupuncturist in and she got better. Like you said, Neil, just because it's not something you've learned or it's something that you've grown up with, it doesn't mean it doesn't work. And maybe we can't explain why it works, but it works.
Like Maritess said at the beginning of this, I think the mind is really powerful. I mean, and that's why we talk about the placebo effect. Sometimes there may be a reason for it and sometimes there may not be. But if we believe that it's working for us and we're seeing the effects of it working for us, then, we can't discount it. I know for me in the oncology world, one thing I learned as a new nurse that I thought was strange at first is that we used to treat nausea by letting people smell an alcohol pad. And these are those older nurses that would say, just rip open an alcohol pad and put it to their nose. And it really did help. And then a few years later, when aromatherapy started making its appearance in the hospital, we started to see a lot of studies about the effects of aromatherapy and how the effect it has on the receptors in your brain and how it can really decrease that need for nausea medication.
Our Pyxis has peppermint oil and essential oils.
Nice.
So you can actually put it up. Yeah, you can actually pull it up and you can pull up essential oils.
Yep. There was one time we had a patient with anxiety and she was just asking, can I just play music? Can I have like a headphones? And I just want to do music therapy. And I told that to the physician and they thought I'm crazy. And I said, no, she wanted to really listen to music. She doesn't need any medication. And she's like, you're going to have a horrible night. And so I went to the supervisor's office and I said, let me just let her listen. But I've never seen it in an order.
We have them on our oncology unit. It's a basket of medicine cups with screw top lids, almost like specimen cups. And there are 2x2s that have peppermint oil. So you can just grab one if your patient is having some nausea or take it to the room. And I don't know what the numbers show. I can't remember if they've done any quantitative studies on it, but it definitely makes the patients feel better.
Yeah, my hospital actually stocks an actual product called Aromatabs for that very thing. I'm not sure if they're peppermint. I feel like we have like lavender and maybe one other scent, but the nurses like using them. But I feel like in my area or at my hospital anyway, that's pretty much the only sort of intervention in this realm that we offer versus acupuncture and like other things that you guys have mentioned. We don't really dabble in that kind of stuff. It's interesting, but I wanted to share my perspective a little bit too. I think my initial thoughts and biases towards this topic is that these types of things are usually not great, not necessarily acupuncture, but especially in the COVID times, I live in an area that's very kind of like anti-government, anti-traditional healthcare. So COVID was a really interesting time. Kind of hate to bring it up, but people saying, oh, I'm not going to go to the hospital. healing crystals and thoughts and prayers are going to fix everything. And it's like, okay, well, your oxygen is like 70%. This is not going well.
Crystals don't help.
It's not going to help you. Yeah. So like that's
amethysts don't work like that.
I know that's my own like implicit bias towards this kind of topic. And I just don't have a lot of exposure to it in my own nursing career. And so I guess I just wanted to share that perspective too.
It's interesting because here in North Carolina, Asheville's a very hippie-ish town, and you'll have people still migrate down towards the bigger city area when their sickness is bigger than their smaller hospitals. And yes, I've seen a tabletop full of healing crystals put out there. You see a lot of people have that tragus piercing for migraines. And I always wonder if it truly works. I've had like this a 50-50 hit. I'll ask the average person like, oh, is that for migraines? And some of them will say it works, and some of them be like, I tried it, but it doesn't work. There's also a lot with acupuncture in that sense, like piercings that supposedly are trigger points for pain or migraines.
And that's where it's at right now. So I agree with everyone. A lot of education should be done, because part of the integrative approach is to really combine, not just do one part, but also do the medicine part. They should take their medications. They should take whatever is prescribed by their physicians, but they need to also embrace that they need to do mindfulness. They need to do meditation or whatever is needed. There is a degree called functional medicine and integrative medicine, and you can actually be a practitioner wherein you combine medications with alternative medicine. There is one study, and I would share, they did a study with patients with chronic pain, and they taught the patients on how to do mindfulness. And one of the focus that they said is, don't think that it's painful. And they gave a placebo. What they found out was the patients who are taking medications, of course, they have improved, and they also have done the meditation practice, but also those who never received the medication, but just did the actual mindfulness practice, reported that they have less pain than before. So if you really would combine both, it would really help our patients. So I'm very interested to see what the future is for our patients and for the providers. I've never seen it in an order. I've never seen it in a Pyxis machine in an order set. I wonder what's going to be in the future.
They're using a lot of that terminology and a lot of those different practices in palliative care, especially as these programs grow outside of the hospital. I know at our facility, we've got a pretty strong palliative care program. So we offer music therapy. We have child life specialists who do a lot of training in the palliative care, which is very holistic. But I know a lot of those outpatient clinics are starting to offer those kinds of things. It's therapy. It's about making sure that people not only are getting their medical treatment, but they're also taking care of their mental health. They have a counselor. They talk about setting up activities with their friends, book clubs, ways to connect with people, and do things like yoga. And like you were talking about, the mindfulness, ways to stay connected outside of the medical treatment so that their life is not all about the medical treatment.
Laura, to your point, I've talked to patients who actually had Reiki therapy to treat cancer.
Yes.
And I'm like so amazed because I've done Reiki therapy for just the relaxation of.
I have a Reiki story.
Really? Okay.
I do. I have a Reiki story. So this was the strangest thing to me, because I think I've shared on here before that yoga did not work for me. Mindfulness is very, very difficult for me. It's hard for me to disconnect from my brain and turn my brain off and really think about it. So I went to this retreat with two girlfriends of mine, and we went to this Reiki class, and it was just the three of us and the instructor that was in there, and it was an hour. So we were laying on the floor, and I swear for 45 minutes of that hour, I'm like going, I cannot believe I am laying here on the floor. I cannot believe that they talked me into this. So I don't know what happened after 45 minutes, or maybe it might have even been 50 minutes. But at some point, I relaxed, and I remember things going dark. And then I remember seeing a light or seeing some kind of flash above my head. And when I woke up, I felt like I had just slept all night long. But it literally, I know that she said that we were about 45 minutes into that hour-long session. And I know I was awake the entire 45 minutes before that. But those last 10 or 15 minutes really, really had an effect on my brain. I don't know what happened, but it was Reiki. And she was like touching us. She was singing. There were all of these sounds around me the whole hour. The whole first 45 minutes, I thought I was wasting my time. but I really walked away feeling really good, feeling really, really good. It was well worth it.
I love that you share that. I do events like that. Actually, one of the healing events that we did, we had sound therapy with that. We had a sound bath therapy with the drums and the bowls. And we had a labyrinth walk as well. But while doing Reiki therapy, they were doing the sound bath too. And what you said about the light, I don't know. Where's that light coming from?
I remember falling asleep. Like, I don't have that sensation of falling asleep or falling out of it. I just remember waking up. It was the strangest experience.
And the energy, like, I can't explain it either. I can't explain where that energy is coming from. She's not even touching, the healer's not even touching, but you can feel the heaviness, but relaxes. It's weird.
It was weird, but I was resistant for those. Yeah, I was very, very resistant. I did not want to be there. I was ready to leave. I can't believe we wasted an hour here, but something happened to me.
Thanks for sharing that, Laura. I really find validity in the topic of complementary and integrative nursing, but what I feel like a big hurdle that we face is that for every one nurse that believes, you're going to have 9 that don't. So while you're trying to integrate this into your patient's plan of care, and even if they come with some of their own beliefs or their own treatments or their own knowledge, and you're trying to be supportive, well, then you're handing off to a nurse who says, they're fine, just get them Dilaudid. Put them to sleep, you know what I mean? Or just put them out. They'll be fine. Oh, they don't know what they need. You'll give them Zofran. They don't want an alcohol pad. Or you don't need peppermint oil. So it's like fighting 2 battles. And then I succeed. And at the end of my shift, and then when I come back the next day, I'm back at the bottom.
Square one.
Yeah, someone takes all of the time and effort you put into it and just crushes it. Or maybe the patient would feel embarrassed to bring it up again. If someone made them feel bad about their cultural belief, or like you were saying, this is why this works. Well, maybe someone's embarrassed if they're or told that's silly, or I don't know if that's real. Or have you asked someone about this? So like, it's not that it's not great. I feel like we just as a society have a lot more education and in the medical field to pursue and to help integrate it.
I think all the points are very valid. I'm going to kind of turn the screws on this. Unfortunately, a big part of it too is insurance wants to see numbers that guarantee results. It's the unfortunate part. So like you said, Eric, like for every one nurse that believes it, and for every 2 or 3 patients that it works for, aromatherapy, I think that's great. You can grab it out of the Pyxis. It's not a big cost. But if they start doing bigger numbers of stuff, the numbers are just going to add up. And I've found interesting in this area and different places in different states, they all have different marijuana laws and cannabis use. I've had plenty of cancer patients, let alone patients that have anxiety or whatever, and they don't want Xanax. They don't want benzos because benzos aren't made for long-term use, but yet we keep people on them forever and then wonder why they're all jittery in the hospital because they're not getting them. And we're not looking at the overall benefit of cannabis use. And that's an alternative therapy that there's not so many bad side effects to it.
There are some states that are starting to pass some legislation around it, and they're also starting to study it a little more. LSD too, the microdosing of LSD is starting to have on these treatment plans. But you're right, Neil, we have to advocate for it, and we have to show some real numbers, some return on investment in order to get some funding behind these things.
Calls for research.
Absolutely.
A lot more research, because I agree. I think to everyone's point, there's a lot of things that we need to educate ourselves as nurses and also to educate the community, because there's so much that we can help our patients, but the regulations, the insurance, there's a lot of restrictions. I understand it. It's about patient safety and community safety, but research is king. We need to do it. We need to really gather more information and educate ourselves. I wanted to learn more about the cannabis law, and educate me one day, please, because I really wanted to learn that.
I get educated, I'll educate you. Yeah.
Yeah.
Sounds like another topic for conversation here.
Yeah.
One other thing I want to bring up just while we are on this subject, and something that touches on what Eric said earlier about how some of the nurses aren't receptive to it. It might not support the patient's choices. That's also going to prevent them from letting us know if they're doing any of these products at home.
Oh,
we need to know. We need to have them tell us what kind of therapies they're taking at home, because sometimes those can interfere with the treatments that we are giving them. So there is some education that we have to do on nurses around that.
We have a golden retriever that comes around 3 times a week. Do you guys have any dogs that come to the hospital?
Yes, as a therapy.
Pet therapy, yes.
Yeah, we get dogs that come around or cats. Our hospital's pretty good about trying new stuff and keeping it pretty steadily available.
That's awesome. Well, believe it or not, we're just about out of time. But before we go, let's quickly summarize what we've learned. First, we've learned that we need to learn more. Consider becoming more educated regarding complementary and integrative practices. Sometimes it's something as simple as music therapy, mindfulness practice, or aromatherapy that your hospital may already offer. Often, it may be something that a patient practices outside the hospital and requests during their hospital stay. Bring the request to the doctor and see where it goes. Sometimes they say yes, or other times they may say no. Perhaps exploring some of these practices can help us in our personal lives. Bottom line is, it's worth learning more about and opening our minds to the possibilities and, of course, the evidence-based research out there. To our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of MedSurg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to MedSurg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurg Moments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love MedSurg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the MedSurg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Laura,
Maritess,
Neo,
Sam,
And Sydney. And always remember, MedSurg Moments is a moment in our lives and a moment in our MedSurg careers that makes a huge difference.